name is Jerem Dastrup. I'm the Director of Influence Marketing here at Dental Intelligence, and we really are grateful you've taken the time to join us tonight. The vision of this entire series started, I would say about 10 months ago, and we officially launched it at the end of last year. This is our 5th time doing a webinar like this, and we specifically have branded it Real Talk with David Hornbrook because we wanted this to be more of you guys witnessing grade A content from experts in the industry, but then having another expert, David Hornbrook, really interview and converse with the speaker. And, there's some of those topics and some of those questions that, you want to ask, and feel free to put it down there in the chat, and I'll be monitoring chat. We've got Kent Coley from Utah Valley Dental Labs. He'll be monitoring the chat as well. And then David will be monitoring that and take the questions that are relevant to the discussion going on and make sure you guys get answers. And sometimes, we might go down a little rabbit hole and we'll pull it all back. But really, it's meant for you guys to witness 2 experts having a conversation about topics you're wanting to learn more about. And so we are honored and privileged to first have David Hornbrook with us, as usual. Always a pleasure. I look forward to this night every month. It's been a riot. And then, of course, Dr. Nathaniel Lawson. I'm going to say Nate. Nate, is that okay? Nate Lawson.
Perfect.
Right on.
Yeah, thanks.
And I'm really looking forward to hearing your content tonight. I've done a little bit of research on you and kind of your passion and what you do. And so with that, David, I'll turn it over to you. You can kick things off and we'll dive right in.
Okay, cool. Well, I'm going to echo and certainly your sentiment about having Nate. We're in for a huge treat. Nate, you've given me so much research that I can add to my presentations. It's so many times it's like, yeah, I believe this is true. And this is what I've done. And it's so nice that see what you've done. And I'm really excited. I know you had a great mentor that I'm sure you're going to mention. Which I thought the world of as well. And I'm just so proud of you. You're a young guy. You're doing some amazing things. You're very active on the lecture circuit. You're very active in what you're doing with some of your Facebook pages and all the information you're sharing. And I just think it's awesome. I remember I was young like you, and I thought I could tackle the world. You are tackling the world. You're taking it on, and you're successful. So I just want to thank you from the bottom of my heart that you said yes when I called you a couple of months ago. I thought you'd say, wait a minute, it's January. I'm going to be too busy. I don't know what I'm doing. So thanks so much. And we're looking forward to this. And for the people that just got on, if you have questions, I may not ask Nate right away if he's in the middle of a topic. If it looks like he's taking a breath, or it's something that I think absolutely has to be answered at that time in the presentation, I will interrupt you, Nate. So I hope that'll be okay. And we'll
absolutely.
If we can get done 10 minutes earlier or so, we'll just go through as many questions we didn't answer. Okay. Aaron will also give you a resource at the end of the program where not only get your CE credits, but also how you can view this at a later date, as well as where you can ask future questions. You get home and think, wait a minute, I didn't get this answer. I forgot this, or now I'm more confused. How can I ask more questions? So without further ado, Nate, I appreciate you being here, man.
Oh, thanks so much, David. And I want to tell you something. I don't think I've ever told you this story before, but I think you might have been the first continuing education lecture that I had seen. I mean, outside of Burgess, of course, or post dental school. I don't know if you remember this. It probably was had been like 2014. You came down to UAB Alumni Day and you gave like an all day lecture about dental materials. And I just remember thinking, I remember in school thinking, continuing education is going to be more complicated than dental school, and it's going to be harder to understand. I remember going to your lectures like, oh my gosh, he's explaining things in such an easy to follow way. And I was like, oh, that's what continuing education is. So but yeah, I just have been a big fan of what you do and the way you communicate and the way you make dentistry exciting. So thank you so much for having me.
Thanks for sharing that. It's my pleasure.
So yeah, what I want to talk about today is some advanced topics in Zirconia. And, we're going to get a little bit deep, I guess, a little bit. When I made this presentation, actually, I have more clinical content, but this one I thought, I don't know, for me, it's kind of fun to just kind of talk about some things that not everybody maybe talks about. So before I get started in that, like David said, I want to acknowledge, where I come from. And I like to acknowledge the people that are down in the lab doing the work that allow me to come and present data to y'all. These are two of our residents, Bushra and Prashta and Brandon, who I'm particularly proud of, just got into dental school at UAB, but he's been working down in our lab. Chuntuck Wong is our resident that graduated last year. And then, of course, John Burgess has been my mentor, still is a mentor to me. I call the lab the house that Burgess built because, we're all still, working on using a lot of his methods and all the stuff that, he has taught me and continues to teach me. So yeah, he's just a great man. So anyhow, and then I also have to say that, we do a lot of sponsored research from different companies, like almost every single company. This is not a sponsored lecture. So I'm going to, I don't think this lecture talks too much about different brands of material. So but I always have to put that out there since I do come from a university. So here's what here's kind of like the outline of the things I want to talk about. And I kind of had it so that I can stop after each question and we can have a discussion, but I can also stop at any point in time in the lecture. But I want to talk about the different generations of zirconia and how they differ compositionally and how that affects their clinical use. Because I think that's when I always say, when I first started talking about dental materials, I just say, oh yeah, there's porcelain, lithium disilicate, and zirconia, and zirconia was just a thing. But there's now just so many different, there's so many different brands of zirconia, but there's different compositions of zirconia that vary, that have huge differences in the way of their translucency and their strength properties. So that's what I want to talk about there. And then I want to get into a little bit about brands and not say this brand's better than that, but just, sometimes, with lithium disilicate, I think people know, oh, I want to use Emax, or I want to use Celtra, or I want to use Lisi, or I want to use, whatever, Obsidian. But like with zirconia, I think a lot of times dentists don't know, is there an advantage of going with one brand or another? And, honestly, there's not a lot of that much information about that topic. So I wanted to talk a little bit about what could be difference between brands of zirconia. I got to talk a little bit about how a puck is made and what could be wrong with the puck. And then at the end, I want to talk a little bit about the evidence for bonding to zirconia. And I'm not going to talk so much how to do it because it's not that hard to bond a zirconia crown. It's pretty easy, but just, like David said, there's a lot of people that are very skeptical of the ability to bond to zirconia. So I just want to show you where the evidence comes from that says that you can. So here we go. Let's talk about the different generations of zirconia. So let me just start off telling you a little bit about what zirconia is. So, zirconia is a ceramic. And I always say, when I was in my background's in engineering, so when I was in Material Science 101, my professor would have said to me, Nate, everything in this world can be made up of three things. You've got materials that are metals, you've got materials which are polymers, and then you've got materials which are ceramics. So ceramics is just a very basic type of material. Ceramic is defined as a combination of metallic and non-metallic element joined by either covalent or ionic bonds. They're defined by being like brittle materials and heat insulators. And commonly, ceramics, I would say almost all ceramics are composed of a combination of a metallic and a non-metallic element. And this is a little trick I think was neat. I had when I was in grad school, one of the other grad students taught me this little trick of naming a ceramic material. So ceramics come from a metallic element, and the ones we use in dentistry are oxide. And so the way that you name them is so zirconia is a combination of zirconium and oxygen. So you just take the last two letters of the metal name off and you put an A at the end. So aluminum is a metal, but alumina is a ceramic. Zirconium is a metal, zirconia is a ceramic. And I just say that because I hear so many people talk about zirconium crowns. So zirconium dioxide is zirconia, and that's a ceramic. And I also kind of point that out just because, if I've just earlier today, I was having a conversation with somebody who had mentioned that that they were told that zirconia is a metal and it's not actually a ceramic. But, zirconia is just by very definition of being a combination of metallic and non-metallic elements is a ceramic. It's a zirconium dioxide, and zirconium is a metal. It's a shiny, lustrous, heat-conducting metal. Zirconia is a brittle, heat-insulating ceramic material. there. I guess I forgot I put the slide in there just one more time in case, just to get that point across. And it's funny too, because I always tell this story. I had a buddy or a friend of mine, it's a she. So she was billing out a bunch of her zirconia crowns as metal crowns because she'd gone to a CE and somebody had told her that zirconia is actually metal. It's not a ceramic. So, all right. So when we think about ceramic materials, they're a combination of the metallic and non-metallic elements. And the way that those atoms are arranged, I always say they can be arranged in two different types of ways. You can have them arranged in kind of like a haphazard order, and that's what's known as a glass material. Or if the atoms are all kind of perfectly arranged in a row, they're what's known as a crystal. And crystals, the advantage of crystals is that because the atoms are all arranged in a perfect row, you can get more of them into a volume so that you can have a higher density of bonds between the atoms. And that makes crystals really strong. So like crystalline materials are stronger than glass materials. So if you think of a crystal, you drop it on the ground. If you drop a piece of glass on the ground, the crystal's stronger. So when we think about zirconia is what we call a polycrystalline material. It's composed of all crystals. So I always think this is a really cool SEM picture. This was taken by UAB. It wasn't taken by me. Honestly, I went to the SEM one day and I was trying to find one of my pictures and I found this picture. And I asked the guys, like, this is zirconia, right? And he said, yeah, this is zirconia. And so I took that picture. So someone else took this, but it's just a neat picture of zirconia because they took it from the side, which we can't always get that picture. And you can see all of these they look like little bubbles here. Those are just crystals of zirconia, all attached to each other, and we call those grains. Each one of these crystals, we call it a grain, and the boundary between a grain boundary. So, zirconia is an all crystalline material. All those atoms are arranged in a perfect order. Zirconium and oxygen atoms, and they're all kind of since they're high density bond, they're strong. Well, one of the things about zirconia, though, when we talk about it being a crystal material, polycrystalline material, has a bunch of these crystals, the way those atoms can actually be arranged in different ways. And, even though they're in an order, I don't know if you remember I remember when I was in chemistry class in high school, they had me pack all these tennis balls into bins in different ways to show me all the different crystal structures. So similarly with zirconia, there's different ways those atoms can be arranged. And the one that was most common, that when zirconia first came out, I mean the famous one everyone talks about is Bruxer. When that came out, that was almost 100% tetragonal. I thought it was 100%. Some people now are saying it's 90%. Whatever. It's mostly tetragonal zirconia, meaning that all the little crystals that are in there, all the atoms are arranged in this tetragonal arrangement. But when there's been newer types of zirconia that have come out, and what they've changed is that they've put cubic arrangement of atoms in there, cubic crystals of zirconia in there. And the difference between tetragonal zirconia and cubic zirconia is that the cubic zirconia is just more symmetrical arrangement of atoms. And so why that's important is if you've got when light tries to pass through zirconia, if light tries to pass through tetragonal zirconia, it can only go through in one direction. Whereas when you got cubic zirconia, which is a more symmetrical arrangement of the atoms, light can pass through in many different directions. And that makes cubic zirconia more translucent. So that's why if you've ever heard of cubic, CZs, like fake diamonds, those are cubic. That's because they're symmetrical arrangement of atoms. So if you ever meet a rapper and they're like, oh, I got these sweet CZ chain, you can be like, oh, it's due to the symmetrical arrangement of the atoms within your, fake diamonds. So this was an example of one of the first translucent zirconias that came out. There's been many like Lava Aesthetic and Bruxer Anterior, and there's many different types of these newer translucent zirconia. And the way they made them more translucent is they've incorporated some of that cubic zirconia within the within the material. And David, you're gonna have to excuse me. I always like to tell this stupid story about, believe me, there's kind of a point at the end of it, of the day that we found out about how much cubic zirconia there was in there. So, in order to determine if there's cubic or tetragonal zirconia in a material, you need to use this machine here. It's called an X-ray diffractometer. And we've got an X-ray diffractometer at UAB. We don't have this one. We have one that looks much crappier and it's broken and it hasn't worked in at least a decade. But this is a fancy one they have at Georgia Tech, and I found out about it. And right about the time that Katana was coming out, Dr. Burgess was going to go give a presentation in Japan. And I mentioned to him, I said, hey, I can get you some data from this X-ray diffractometer at Georgia Tech. And he said, oh yeah, that'd be great. And so obviously I'm trying to impress Dr. Burgess, of course. So I called the guy at Georgia Tech and I said, he's going to be there in a month. Like, can you get me this data, before that? And the guy says, oh yeah, sure. And so it's like 3 weeks, 2 weeks before, 1 week before, then it's like a day before Burgess is supposed to go present in Japan. I basically need to know that night how much is in there. And so I call the guy at Georgia Tech and I say, dude, I don't care what you need to do, but I just need to know anytime tonight, just call me at your convenience. Here's my cell phone. So I go home and I'm going out to eat dinner with my girlfriend at the time. And we're going to some, fancy Italian restaurant. And the guy from Georgia Tech calls me. He's like, oh, Nate, hey, we found out it's like 50% cubic zirconia in this specimen you gave us. Like 50%, that's a lot of cubic zirconia. I wouldn't have thought there'd be that much, but okay, 50%. Say, thanks a lot, 50% cubic zirconia. And I hang up and I look over in the driver's seat. She was driving at Rachel, and she's looking back at me and she's like, Nate, she's like, you are a cheap bastard, but if you just bought my cubic zirconia engagement ring on the phone with me, this is never going to work out. So Rachel's downstairs and she's eating her dinner right now. So it worked out, and I gave her a real non-CZ ring. But I always tell that story because I just think it's so funny. It's true story, and that's a true fact. So like there's some debate about actually exactly how much cubic zirconia is in there. There's a great paper published by Yu Zhang and Brian Lawn in JDR where they estimated at 50% for the newer translucent types of zirconia. And so how did they get that cubic zirconia, translucent zirconia into the newer types of zirconia? They do it with this little molecule, yttria. And when you add yttria to zirconia at 3 mol%, you get something like the Bruxer type materials, the things that are all tetragonal and very opaque, but all tetragonal zirconia. In order to get some of that cubic in there, you got to throw in 5 mol% yttria. Actually, if you throw in 8 mol% yttria, you'll get 100% cubic zirconia. 5 mol% yttria, you'll get 50% cubic zirconia. And then like then after that, there was more materials that came out that kind of played in between, where they put 4 mol% yttria in there and they got 25% cubic zirconia in the materials. And so, we try to be cute and come up with names like first generation, second generation. Honestly, the first generation was like the framework materials when they were still layering porcelain on top of the zirconia. So then we call things like the Bruxer generation, the second generation. And then the 5 mol% yttria would be the third generation. And then the 4 mol% could be the fourth generation if you wanted to, be cute like that. So, so those are, and when we go and we talk about this stuff, it used to be one of these things where it was only the nerdy research people that would talk about 3 mol% yttria, but now it's, these types of zirconia are so common. I think we have to have some way to talk in the industry about what type of zirconia you're using. So I think this terminology is actually starting to catch on, where, I'm calling some labs, calling some other dentists, talking to people in audiences and stuff, and we'll talk about 3Y and 4Y and 5Y, and they're not looking at me like a nerdy researcher. They're like, yeah, dude, we know about 3Y, 4Y, and 5Y now. So it is starting to catch on. I think there's still a lot of people that don't know about it, but I don't feel like just a huge research nerd talking about 3Y and 4Y and 5Y. Again, 3Y is the the original stuff. 4Y's got about 25% cubic, and 5Y's got about 50% cubic. And so these are some different, this was the paper I was talking about from Yu Zhang, and oh, it's so funny. I gave myself credit for that paper. It's Brian Lawn, not Lawson. I thought I wanted another publication, so I put my name down there. But these are some brands that they had listed out for being 3Y, 4Y, and 5Y. And honestly, it's hard. And David, I'd actually be interested in hearing your kind of opinion about this too, because, you know, how does a clinician know, you know, which type of zirconia, if there's zirconia is 4Y and 3Y and 5Y. That's why I like this publication. But I'm always kind of, people ask me, I'm like, well, you know, this is a list I've got and it's published, but I don't know if you have any thoughts on.
Well, it's kind of interesting, and maybe I missed it, but I think it's important to at least mention that, you know, the lower the Y, the stronger, and the higher the Y is weaker, right? And so you talked about translucency. And honestly, the 3, 4, and 5Y, a lot of the manufacturers don't even talk about that. They either say super translucent, highly translucent, ultra translucent, or tetragonal. And so I think most, and also, you know, my relationship with Utah Valley Dental Lab as a clinical director of education, I get these questions all the time from doctors. Yeah. I think most doctors, honestly, are learning it from their ceramist, or they're saying, hey, can I have some zirconia that looks good? And you look at your slide. I mean, Zircat MT is a beautiful material, and a lot of people are using that as a very high translucent. Although we have materials like Isostatic, which is even more translucent. And, you know, I think for people that want to be educated, and I've said this, and you know, you're the great example of this, is as clinicians, we're scientists as well, and we need to start kind of being more involved. Right. Instead of just ordering a ceramic crown. I mean, we should be calling our lab and saying, listen, I want to know which of these materials, I want to know the strength of the materials. Because I choose my materials based on its application. If it's on a second molar and it, you know, I have minimal occlusal thickness, you know, I'm not going to go with a 5Y.
Yeah.
But if I have all kinds of room and I'm moving forward, I mean, 5Y is exactly what I'd go with. So I think education by our ceramists probably is the best place to get it.
Yeah. And I love what you said too about like, because sometimes I'll call, you know, I worked with a number of different labs for different projects and stuff. And like, sometimes I'll call and I'll say, hey, I want to use a certain type of, or what type of zirconia are you using? And if it's a brand I don't know, and I'll say, is it 3Y or 4Y or 5Y? And they'll say, oh, well, it's, you know, 1200 megapascals. And I'm like, well, that's hard. You know, it depends who makes it. Like I can make a bar of a material and have perfectly smooth edges and really flat. And I can get 1200 megapascals. I can make the same bar and the edges aren't so clean. And, you know, we made it and we didn't polish it so well and we got 900. So sometimes, and it's also if you're doing biaxial flexural strength or 3-point bend flexural strength. So sometimes, I like knowing compositionally what my materials are. Sometimes, I mean, it's good to know flexural strength too, but that's only helpful to me if I'm looking at a study where they've measured a bunch of different materials the same way and I can compare it. But if someone just says to me, oh, it's 1200 megapascals, doc, use it. I don't know. That's just my little bias.
You know, it's interesting too. The laboratory, they don't want failures any more than we do as clinicians.
Yeah,
and they're going to pick, and they also don't want to hear from the doctor that it was ugly, right? Yeah. So, you know, I think they're going to give us the best advice. They want to make sure that it's not going to fail and it's not going to look ugly. And there's so many great materials. I mean, you showed all those, and you know, there's so many amazing materials out there.
That's why I think it's good to have some education about it, so that, you know, from in the clinical side, from the lab side, that we can speak with manufacturers to kind of be like, you know, we want to know about compositional differences, and you have to know what they are to ask about them. And then maybe they'll be shared more widely. And a lot of the companies I work with, they do share, you know, what the composition of their zirconia is. But anyhow, this is a slide to kind of show what we're talking about as far as difference in translucency of different ceramic materials. I have to give a big shout out to Hernan. Hernan was a master dental ceramist who was teaching the in-house lab program at UAB while that was still going on, and he made these beautiful crowns. Jean Shihad milled these for us, and then Hernan stained and glazed them, and you know, made them look really pretty. Even the 3Y zirconia look really pretty. But you can see, you know, in that second molar is a 3Y zirconia. The 5Y zirconia was on the first molar, and you can see it is more translucent. The 3Y is more white opaque. I mean, it's kind of just a fun case. I mean, who cares on a first and second molar, but it was just to kind of show we just wanted two crowns side by side to show it. But and David, like you're saying, of course, there's the trade-off. So I only talked about I started just talking about translucency and why do we put 5Y into zirconia so that we could get why do we use 5Y so we can get cubic so that it can be more translucent, but there's a trade-off. And I always say that, with the original 3Y zirconias that had all this tetragonal zirconia in it, tetragonal zirconia, I call them just magic. And because it can do this very magic thing, which is transformation toughening. And what transformation toughening means is if you have a zirconia and it's arranged in that tetragonal arrangement, if you apply a stress to it, those atoms will expand and they'll get 3 to 5% bigger volumetrically. And why that's a big deal is that if you've got, so here I'm getting ahead of my cartoon. So they expand, they get 3 to 5% bigger. So if you've got a bunch of these tetragonal crystals in your zirconia crown and they're all up next to each other, and then you do something like grind on that crown, or you sandblast it, or the patient bites on it and a crack is started. When that crack is started, it causes local stress on these tetragonal zirconia grains, and in response, they'll transform and they get bigger. And what happens when they get bigger is they compress that crack and they stop it from growing and getting any larger. And so I call that the magic of zirconia. And Illumina doesn't do this. It's not done by glass ceramics. It's something that's only done with the tetragonal zirconia. And if you put in, I've seen some people talk about, reinforcing materials with particles of zirconia. I don't think that if I think the material has to be a polycrystalline zirconia with all zirconia. If you try and reinforce with something with zirconia, it's not going to have the magic because the cracks will just go through the other phase. They'll skip the zirconia particles. So that's kind of the magic of tetragonal zirconia. And one of the things, though, I had always wondered, so we talked about the 3Y, I'm calling 100%, if you want to be technical, you could say it was 90% tetragonal zirconia. And that one definitely can do the transformation toughening. And that's what made zirconia so famous. But the thing I never knew, though, was if you have 4Y zirconia or 5Y zirconia, and they have cubic in them, but it's not like they're not all cubic. 4Y's got 25% cubic, and it still has the tetragonal in it. And then the 5Y's got 50% tetragonal, 50% cubic. And I wondered, though, when you water down the tetragonal zirconia, is there still magic left? I knew there wouldn't be the magic left. Transformation toughening wouldn't be as much as the 3Y, but is there any left? And I didn't know the answer until this was, one of the nice things about quarantine is I had some time to, go and read through articles. And there was a really, really nice article came out by, it was like a collaboration between these two really famous research groups. One was the one from Belgium with Van Meerbeek, and then in France, there's a guy named Jérôme Chevalier. And they published this paper, which was just for me, it was like dental porn. It was or dental research porn or something. I read the thing 3 times because it was just so cool. And they did the study, and I'm kind of simplifying what they did, but they got some 3Y zirconia, they start a crack in it. And then, let's say they start the crack over here. And once they start a crack, the zirconia will start to transform. And you can see these, this is a different view of the grains of zirconia. The ones near the crack look kind of, I call them squiggly. And that's where they've transformed, and they've tried to do their magic and stop the crack from growing. But then they would push the crack a little further, and then it would transform again, and it would stop it. And then they push it further, and you could see they keep on transforming and transforming and transforming, and it's just doing magic, 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 magic. I just think little fireworks of magic happening as they try to push this crack along through the 3Y zirconia. If you look at the 4Y zirconia, they push it through, you see transformation, but it travels a while before it does some transformation. And maybe it goes through some cubic zirconia before it gets to tetragonal and is able to transform again. And you can see there's still transformation, though. There's still some magic left in the 4Y zirconias, but not as much as the 3Y. And then if you look at the 5Y zirconia, it's hard to say if there is any, maybe a little bit of squigglies. It's hard to tell if there's, but most of the magic is gone by the time you get to the 5Ys. So the 5Ys, most translucent, but you're going to be losing out in strength and in transformation toughening. So I want to show you, when we talk about strength of the materials and the 3Ys and the 4Ys and the 5Ys, and we talk about the loss of the magic. I'm going to show you a bar graph of showing you all the different strengths of these materials. But before I talk about just strength of the materials, the 3Y, 4Y, and 5Y, the other thing to keep in mind is the strength of the materials once they're bonded or if they're unbonded. So I'm going to show you one other study that we did, and then I'm going to show you all the strength of the materials, and then we can talk about clinical applications. So in order to get an idea of the strength of the different materials, bonded and unbonded, we can't do bars like we normally do. We do this test I call crush the crown. So we get these little copings made out of a dentin substitute. It's just this resin composite material. And then we make 0.8 to 1 millimeter thick. These are the dye. These are the dyes. These are the copings. So the dyes are made out of resin composite. We make copings that are 0.8 to 1 millimeter thick of 3Y zirconia, 5Y zirconia, and Emax. And we half of them we bonded, and half of them we cemented with conventional RMGI cement. And then we fatigue them in something called the Alabama Slammer, and then we crush them and look at their strength. And this is what we got out of the study. And this was, I can't see if the reference is on here, but this actually got published, I think, a year or two ago. And there's a couple of things I want to point out. So just to orient you with the graph here, because sometimes I just see a graph, I get a little bit lost. The graph is looking at the crown fracture strength. We've got the 3Y zirconia, the 5Y zirconia, and the Emax. And the green bars are when it was bonded with resin cement, and the pink bars is when it was cemented with RMGI cement. And a couple interesting things we found. First of all, with lithium disilicate, great material, but when we used at that thickness, if it was cemented with RMGI cement, it didn't survive the fatigue test to even get a strength value. Another thing that was interesting between the Emax and the 5Y zirconia was that they had the same strength once the two things were bonded. But you could see the 5Y zirconia, when it was conventionally cemented with RMGI, survived the test, and it was a lower strength, but it did survive the test, unlike the Emax material at that thickness. So that tells me two things. First of all, once they're bonded, they're going to have a pretty similar strength. But one problem that a novice like me runs into is when I'm doing lithium disilicate crowns, particularly in the posterior, if they're kind of thin and I'm doing a try-in, I've had issues with fracture during trying, and that's when the 5Y is stronger prior to being bonded. If you're doing a try-in, so it's a little bit more foolproof, fail-proof, I don't know, whatever the expression is. It's dummy-proof for dummies like me. So it gives me an opportunity to try it in without having to worry as much about fracturing it. And then also there's always going to be those, I've got friends that are just like, Nate, I don't want to bond, I don't want to use resin cement. If you're going to be using RMGI cement, again, I think that's maybe a place where the 5Y is a little safer. And then with the 3Y zirconia, if you conventionally cement 3Y zirconia at this thickness, it was the same strength as these other materials bonded. And then, this is a little controversial, but, in our study, we showed that if you bonded 3Y, you could strengthen the material even further. So, if I've got a really thin molar crown, and it's like one of those ones where like I get it back from the lab and I got the model there and I'm looking, and it's like, oh my God, I feel so bad. What have I done to this poor lab? And they've been so nice to like somehow get a restoration to fit inside of there. But man, it's thin. So I'm like, okay, I'm bonding this guy. Even if I didn't need it for the retention, I would bond it to reinforce the material for its strength. And so this is kind of the slide I was getting to, which was, these are just kind of average strength values of the different materials. And then, honestly, the American Dental Association makes recommendations based on flexural strength and fracture toughness for clinical applications. I think that my number, I didn't use that. These are just my personal thoughts. And David, I'd love to hear, your opinion on this too. But these are just my thought of the strength and how that would, how that means the materials could be used clinically. So like porcelain, of course, porcelain has no crystals in it. It's got a few crystals in it, but it's mostly glass material. It's only strong enough to exist in the mouth if it's bonded, to enamel or bonded to the coping of a PFM or PFZ. And it's got a strength of about 100 megapascals. Lithium disilicate is in that 450 range. For me, lithium disilicate is a great material for, anterior bonded crowns. We did this practice-based research network study. We looked at 4,000 crowns cemented by, I think, 200 dentists in the United States, or I think some number somewhere around there. Anyhow, we found out that, most lithium disilicate crowns are bonded. And then, I actually want to quote another study, which was that 47% of dentists used lithium disilicate as the material of choice. 47 or 67. Anyhow, must have been 67. It was like the majority of dentists use lithium disilicate as a material of choice for anterior crowns. That was a practice-based research network study. That's why I need my slides. I should never try to say something that's not in my slides. It's easier when I can look at numbers like that. But the majority of dentists for anterior crowns are using lithium disilicate. So it's a great material for anterior bonded crowns, and for non-retentive bonded onlays is probably still the most common thing. Even though I believe in bonding to zirconia, I think it's probably still most common material used for these onlays and overlays and stuff. For 5Y zirconia crowns, and this is again just my opinion, I think it's for people that aren't bonding, that are going to use RMGI cement, I think that 5Y is way safer than using lithium disilicate. So I think that's a great indication for the 5Y zirconias for anterior cemented crowns. Of course, you can bond them as well. And then I've been doing those, and I guess this is where I get into that dummy proof thing for these. Sometimes, I've had issues with trying to try in some thin premolar lithium disilicate crowns and have fracture during try-in. And so I kind of, with 5Y, just feels a little safer. You can try them in without having to worry about fracture. And, once you bond them in there, they're going to be nice and, strong. 4Y, I think, is a great material for anterior fixed partial dentures because 4Y still has the magic left. You could use 3Y zirconia for anterior fixed partial dentures, but you've got to layer it. I think 4Y is, aesthetic enough that you could use it monolithic, and it's still got some of the magic left, so you could use it for anterior fixed partial dentures. And I got that with, I'm talking about again today, my David, I'm sure you probably met Taysir Suleiman from UNC. I call him my biomaterials brother because we do the same. We're always doing the same research. We're publishing things like, dude, I was going to publish that. So he does all the same stuff at UNC. And then so for 3Y zirconias, I think, for posterior bridges, that would be the only ceramic material I'd consider. For molar crowns, I think it makes a lot of sense. And then, like I said, if I've got that thin 3Y zirconia, I'm thinking about bonding it, even if I don't need it for retention, just for the strength, because I think you can reinforce 3Y zirconia with the resin cement if you bond it. So, these aren't official recommendations, but this is how I've, wrap my little brain around recommendations for use of the materials. And I think, I don't know if there's any thoughts on. I have one other thing I want to talk about before my next stopping point, and I don't know if you had any thoughts on this or.
Yeah, let me just add a little to this, because what we see in the laboratory is, we look at strengths, and you did address it, but again, this is where I think our ceramists can really help us out, because we got these strengths, but what we see is things are under prepped. So we'll get a premolar crown with an Emax, or a first molar that they want Emax, and they've only got 1 millimeter of occlusal reduction. And that's where I think when we go to a 5Y, and I tell people that, I could show you a 5Y crown and an Emax, and you could hold it up to the light, you could bite on it, you could play with it. You could not tell the difference unless you looked in the inside and saw the mill marks, right? And so when I see these things, especially dentists that under prep, and we all do to some degree.
I'm awesome at it.
Yeah, I think we all are. The longer you practice, the better you'll be at it, I think. We now have materials. I call another tool in my tool belt where, the lab now calls and says, hey, you know what? It's a maxillary first molar. Yes, it's visible. We want it to look good. You've under prepped the occlusal. We can now go to a material that it's a tool that I don't think we've ever had in the past. We can have an aesthetic material that's, 1.5, almost twice as strong in those scenarios. And I think this is excellent. I would also add on this chart for the 3Y is the all on X's, the all on 4 and 6, the large framework bridges. We have to use something that's strong, and we're getting excellent results with that.
Yeah, I was talking to a friend of mine, and I think maybe I saw him posted on social media, or was it anyhow, doing an all-in X on, it was either a 5Y or a 4Y, and I just thought, why are you doing this? I mean, that would make me nervous to go to a full arch on anything other than 3. I mean, you don't see that much.
No, not well. Now with Prime, and I don't know if you're going to talk about Prime. Most of the stuff Utah Valley is doing is Prime now. And are you going to talk about it at all?
I hadn't planned on talking about it. So yeah, if you want to talk about, I'm familiar with it, but if you want to say anything about it, that'd be great.
So, it's kind of interesting. So the Prime, Nate showed that puck that was a katana puck. We call it a puck or a disc. It's 100 millimeters in diameter, anywhere between 14 and 22 millimeters thick, right? So imagine if you have a 22 millimeter thick puck, looks like a hockey puck, a little bigger than a hockey puck, not quite as thick. So what Ivoclar did, most of you have probably seen their ads because they're bright pink and they're Emax Prime. What they did is they actually did a gradient within that puck from a 4Y to a 3Y, not 5Y, but a 4Y and 3Y. So what they can do on these large span bridges or the all on X's, the digital designer can actually bring the framework in the digital design. So all the connectors are in this 3Y. And the cool thing about it, their 4Y is actually really translucent. Almost equivalent to what we'd see with Lava Aesthetic. It almost looks like a 5Y. So we have this framework that is all this where we need the strength, all the connectors, the majority of is 3Y, but the incisal 4 to 5 millimeters is all 4Y. So now the Ceramis, instead of having to cut back those incisal edges, which weakens that system, they can actually just superficially stain that prosthesis. And we're getting really good results, and they look absolutely beautiful. You'd swear they've been cut back and layered. And so I would say Prime is an option, but if a lab isn't using Prime, they absolutely have to go 3Y on these systems. But as you said earlier, they're ugly. They're opaque and they're ugly. So you have to cut back the incisal edge to make them look good.
Yeah. No, that's thank you. That's awesome information. And yeah, I had my first Prime crown actually. Because the lab that I usually do, I have a lab I do a lot of onlays with, and I don't usually do much zirconia with them. And I sent them off like 2 onlays and a crown. And so they made the crown out of Prime, and I don't know, it's two crowns and 2 onlays. Yeah, and the 2 crowns were 2 premolars out of Prime, and I was pleasantly surprised. It's been one case though, but yeah, I was pleasantly surprised.
That's 100% success, Nate. That's good. Stay with it. Maybe you shouldn't do anymore.
And this is the one thing. This thing is just for fun, and I think that this is a topic that almost never gets talked about, and I don't even know if it really needs to be. I don't know how important it really is. And this is something called low temperature degradation. So with zirconium, we got all these tetragonal crystals. If you introduce, remember we introduce a crack to them, they can spontaneously, or they don't spontaneously, they transform and become less dense, and they become bigger, and they stop the crack from growing anymore. And that was called the transformation toughening. Well, sometimes, even though we don't want it to happen, they just will spontaneously transform and get bigger. And that's not so cool, because if they spontaneously transform and get bigger. Then they're kind of pushing up against each other. And, you know, if you got something confined to a space and it all gets bigger, it's going to start cracking. And that's what was known as low temperature degradation, when they just kind of spontaneously get bigger and then they cause a crack. And why this got to be such a big deal, honestly, in my opinion, is because in the implant industry, like not dental, in the orthopedic implant industry, they were using zirconia, and there was some company that had this bright idea that they were going to go autoclave their zirconia specimens or their zirconia implants before mailing them out. And this low temperature degradation, they call it low temperature because this is something that happens in water at low temperatures, which means body temperatures. But if you put something in an autoclave, it will accelerate that process and it will cause like 100 years worth of low temperature degradation in an hour or something like that. So maybe not that extreme, but it accelerates it. So they had this issue where they put these things in the autoclave and then they put them into patients, with these hip implants. I think they're hip implants, and they saw all this wear of the ball that was inside of the zirconia, cup, because the zirconia had all started cracking and wearing away because they'd put in an autoclave. And so like that was, I think, where this idea that low temperature degradation could be, or just spontaneous transformation of zirconia can be such an issue. But I mean, dental zirconia can undergo low temperature degradation. And again, they do these kinds of tests where they'll put it into an autoclave for various amounts of time, 10 hours or 50 hours. And they can show from the surface of the zirconia that you would start to see some of these grains separate because they're transforming and there's getting cracks in between them. And you leave it in there for longer, in 100 hours in the autoclave, and you can see these, thicknesses of, that's probably somewhere around 60 microns or something of transformation zone from the surface of the zirconia. The problem is, though, that nobody really has the patience to do these types of studies in real time or do them clinically. We try to do a study where we had patients wear a zirconia crown for a year with temporary cement, and then we took it out and then we actually mailed it to Georgia Tech, and they measured to see how much transformation would occur on the surfaces of the crowns. And we got some data back. It was like 5% of the surface of the transformed, or 10% for, depending on the crown. The thing that I'm most interested in, and we try to figure this out, but is the depth into the crown. So like, if you're looking at the crown from the occlusal surface, where is this cracking occurring on is it cracking a millimeter into the crown, or is it cracking on the outer half of a micron of the crown? And it's close, and it's the outer half of a micron is really what it is. So somebody did this study that found that in a year's time, in regular, body temperature, the amount of cracking that occurs is half a millimeter per year. Half of a micron per year. So that means in like 10 years, you get 5 microns of cracking through the surface of the zirconia. And I just think, who cares? They try to make some scary, estimation of 5 microns or maybe 20 microns could cause a Griffith flaw failure. But I just kind of felt like zirconia crowns have been out for over a decade now. Like we don't see these things spontaneously combusting in people's mouths from low temperature degradation. So that's my kind of feeling on. We tried to study it, and I was interested in it. And the crowns that we got back from wearing in the patient's mouth for a year, we sectioned through them and tried to see any surface cracking from them, and we couldn't even find it. It was too small to even see. So I don't get too excited about low temperature degradation.
Can I ask you a question on that? Wait, well, what's the temperature of an autoclave? You have any idea?
I don't know, like 2, isn't it like 2 something, or I don't know what it is.
Okay, so I'm curious if you've done any studies where you've measured that transformational zone or non-transformational zone based on how many times that crown was fired. So, if you put low fusing porcelain stain on that zirconia crown, right? Mm-hmm. Let's say it's a 4 wide, so you're looking at about 800. If the ceramist was in there and did multiple bakes, so now at 700 degrees C, I don't know if that's a low enough temperature. Are you going to see degradation at something that's fired multiple times?
I don't know if that has something. But you also need to have water in the system too. And so I wonder if that's why you can put it into the furnace without experiencing low temperature degradation like you would in an autoclave.
I've never seen a study where they've actually, it's right out of the mill. They sinter it and they do the studies.
Yeah.
What they've done where they've
whole time.
Yeah.
Yeah.
There you got your next project right there.
Yeah. Yeah. Yeah, I don't know. I feel like it's, some of these things are so nerdy that once you get down to low temperature degradation, people are like, I don't know. I can't see the numbers of how many people logged on. We should have looked to see how many people were logged on before I said the word low temperature degradation and now. But anyhow, that was kind of my first stopping point. I'm doing actually. I can keep on going without, if there are any questions I can answer.
Yeah, just one question that came up early, but I know you would answer it. So I'm going to address it. Someone asked, can you use an RMGI for zirconia? And you absolutely answered it. Depends on how thick it is, really. And, you didn't talk about retention necessarily of the prep, but yeah, I think you absolutely answered it. That, if you've got a thin zirconia, RMGI is not what you should be cementing it with. And you should not be using RMGI with Emax.
Yeah, I'm not a big RMGI Emax person. And I think they say, so if it's 1.5 millimeters, you can use RMGI, but I've just, 70% of dentists, we did the study, 70% of dentists conventionally cement zirconia with RMGI, but 70% of dentists bond Emax. And I was surprised it wasn't higher than 70% on the Emax. I guess I'll go into this part was the interesting part, because I made this part up, this lecture, the early part of my lecture has been given for like years now. This part I made up recently to talk about the different brands of zirconia. And I just did kind of a deep dive into this topic because I'd always been wondering, why should I buy Prime? Why can't I buy, the cheapest zirconia that I can find, on the black market? So what are the differences between different types of zirconia? Brands of zirconia, rather. One of the things, there's something called the American Dental Association Clinical Evaluators Panel. And that's something that I worked on for the past year. And this survey and then the one that came out before it were kind of like my babies, the ones that I really worked on. And I blurred it out because I had the data before it was actually published, but it's now you can go you can just Google ADA Clinical Evaluators Panel and you can get this whole report for free. It's got a bunch of information about zirconia on there. The whole report was all about zirconia. And there was one statistic that we got information about, but we weren't allowed to publish for whatever reason. But I loved this. I thought it was really interesting. We asked them on the survey if the dentist, wrote, please make me a katana or a lava aesthetic or whatever brand of zirconia, or did they just write please make zirconia crown? And 68% of dentists just put please make zirconia crown, which that doesn't totally surprise me. I think that zirconia has really just become like a commodity. That's what they always say. Whereas lithium disilicate might become a commodity too pretty soon, because there's starting to be more and more different kinds. But for a long time, everyone would say, "I want Emax. Give me Emax." But for zirconia, it's just zirconia. So that made me think, about what are the different, could be different between different brands. Oh, and here's where you can go and find that. Now if you go on there, you can see the more recent ones where you can find the one that I just showed you about zirconia. All right, so in order to start talking about, what could be different about different brands, I'm going to kind of walk through the process as I understand it. I don't make zirconia, but as I understand it, how zirconia is actually fabricated. So zirconia starts off in a powder, before it gets to that hockey puck looking thing, it starts off in a powder. And these were actually 470 lab is lab 470 at the UAV material science lab. I just took pictures of, we had a ceramic engineer at UAB, and he when he does research unrelated to dentistry, he goes and buys this zirconia from a company called Toso, and he can buy 3Y zirconia and he can buy 8Y zirconia. And these are what the powders look like. And that's how all zirconia starts. And actually Toso is a brand that a lot of the different major manufacturers, or a decent number of major manufacturers, we'll use actually Toso. It's a company in Japan. They process zirconia and make it into these little powders. So it starts off in powders. You can get the 3Y powders. You can get 8Y powders. You can get 5Y powders. And this is what they look like. And, I know that the powders, even though some companies will buy their powders from Toso, there's still other things that they can add to their powders before they press it into the hockey puck that can make them different. I mean, a big thing is colorants. I mean, what kind of colorants they're going to be using to get the colors of their zirconia. But then there's also minor things like binders and things that I would never know, because of course it's not like anyone's going to give you their formula for their zirconia, but the powders can be slightly different. But this is one of the things that I think that we don't talk about as much or even think about as much, but the way that they get those powders into that puck shape can also have an effect on the zirconia. So in order to get the powder into the puck, you have to always start with doing something called uniaxial pressing. And again, they have this at the Material Science School at UAB. It's just a mold, and you put a bunch of powder in there, and it's got a platform, and it just presses it, squishes it down, and presses it into a puck shape. The next level up, though, is once you get that puck shape that's been uniaxially pressed, is to get it to more homogeneously compact it, and you have to do that with a different process. So the disadvantage of you only uniaxial press is that this top layer is packed tighter than the bottom layer. So the top layer is going to have, the particles are just going to be kind of closer together than at the bottom. And so that means when you, mill your crown out of this and then put it in a furnace to sinter it, you're going to have more shrinkage down at the bottom part where it just wasn't packed as tightly. And that was based on a study that was done in 2010 where they showed this with uniaxial pressing. So the next, if you want to take it a step up in fabrication of zirconia, is isostatic pressing. And that's where you put it into I just think putting a Ziploc bag and then throwing it into, I don't exactly know, I don't know if they're putting it into I assume they're putting it into some kind of liquid and then applying pressure from all directions. And that's just to more homogeneously condense those particles of zirconia. And it's called isostatic pressing. And I've seen, not every company does isostatic pressing. I think 3M they always, they're very proud of the fact, I think they kind of developed this process. I've seen these isostatic presses in Japan, where I've seen the manufacturer Katana. I don't know. I mean, I'm sure many people isostatic press, but, I don't know all the ones that do. All right, so after you've now compacted this zirconia into a puck, you've got to go. This is what it looks like. I just took this picture because I was always curious to see what the zirconia look like when it's compacted. It's compacted, but there's still a lot of porosity inside of there. And if you've never seen a zirconia puck before, this is what they look like. They kind of have the consistency of chalk. I think they're actually stronger than chalk. I thought that they were, they're a little bit stronger than chalk, but they more or less the consistency of chalk. So the next thing you're going to do is you're going to mill the crown out of that, and you're going to see this big oversized crown, and then you're going to sinter it. And what sintering means is it just means all those little particles of zirconia that got pressed into that disc, you're going to heat them up. That's a cheap animation, but just heat them up, and they're all going to kind of fuse together into one big mass. And that's what the process of sintering is. It's just the fusing of all those different particles. And then as you continue to apply heat to the zirconia, the grains are going to, those particles where they came together, those are now called grains. They're going to start growing, and they'll start even kind of joining up with each other. And so you can get so the first stage is just sintering them all together, and then as you continue to heat them, you're going to get grain growth. And if my slide's in the right order, eventually I'm going to talk about the significance of grain growth. Here's just to show you what a crown that comes out of the mill looks like, and then this is what it looks like once it's been sintered. So it gets, I've heard numbers around like 30% smaller once you sinter it into the furnace. So, well, that's one of the neat things about zirconia, and I've actually been reading this in the CEREC community of people talking about now they're starting to mill zirconia and they're happy with how well the fit of their crown is, and part of that can be attributed to the fact that you're milling something that's much larger than your final structure. So you can put, the details that you can mill in, if a burr is the same size, making that same details in lithium disilicate, that's the final size of those details. Whereas if you make those in the pre-sintered zirconia, then by the time you shrink it down, the details are going to be even finer. So that's one of the other kind of neat things about zirconia. So, yeah, that's what I was afraid of. I think my slides got a little bit out of order, but one of the disadvantages, if you had a puck that was just only uniaxial pressed, and the particles aren't compressed in the same way or compacted in the same way in the bottom of the puck as they do on the top of the puck, then you can have uneven shrinking of your zirconia. And I feel like, that's probably not a big deal in a single unit crown, but maybe in like a 4-unit fixed partial denture, if you've got some uneven shrinking of your restoration, that might not be so hot. All right, but now I want to go back again and talk about grain growth. So
let me add to that a little bit.
Yeah.
I totally agree with you on that, and the sintering process is paramount in success of these restorations. Most laboratories, commercial laboratories, are constantly calibrating their sintering furnaces. I mean, that's a big deal. If something happens, or all of a sudden they get all these crowns that aren't fitting, they're going back and they can basically say it's because this one sintering furnace wasn't calibrated. Now that we got, you said CEREC doctors and the plant mecha doctors, a lot of them have gotten into zirconia, and then sintering it is really crucial for them to stay on top of the calibration of the sintering. I think even more so in the calibration of the oven for crystallization of lithium disilicate.
Yeah, that's I think I mentioned earlier John Sheeha from I think it's North Star. His lab's in California. He's a huge zirconia sintering nerd, and he was talking to me about even try to calibrate within the furnace, different places in the furnace will have different amount of heat, and I can only imagine how he's really into making sure your furnace is calibrated in all the different parts and cleaning it out. And I can only imagine all the things you have to think about running a lab. As far as the, talking kind of about some of the stuff that's going on in the lab, when sintering occurs, so sintering is putting into that furnace and heating it up so that it turns from that chalky looking thing to the crowns that we know and love. The amount of time and the temperature at which you sinter things can, essentially what it's doing is it's causing grain growth to occur. I mean, that's, the grains start off small and then they get bigger the longer or the hotter that you sinter a zirconia for. And I think people have tried to play around with that stuff to get properties that they want, because grain growth can also affect translucency and strength of zirconia. So it is in a tricky way though that it affects these things. So if the grains are really small, then that can be good for translucency, because if they're small, then they're smaller than the wavelength of light, and then light can pass through. But you can also make grains really big, and that can make them more translucent, because then there's less grain boundaries, the boundaries between grains, and the grain boundaries are what stop the light from going through. And same thing with strength though, is if the grains are too small, then the zirconia won't transformation toughen. So it can't go from the tetragonal phase and get bigger. Same thing if it's too big, then they can't transform. So there's kind of a happy medium there. So the point of this is it's too complicated to try to guess what's going to happen. If you, like, if somebody says, oh, my zirconia looks, didn't have the desired properties, is it going too long, or is it too hot, or is it too short? It's just really hard to know exactly what's happening, with the microstructure. But the thing I think is the most important is kind of following the manufacturer's recommendations for the sintering time and the sintering temperature, because playing with grain growth, I mean, it just, as I sit there and I try to summarize 4 studies here, as I look through the studies don't totally agree, and we don't really know what's happening when we grow grains to different sizes, or, by sintering different temperatures and times. Just try to assume that the lab is trying to optimize their properties by looking at many different sintering times and temperatures. And I just wouldn't try to play too much with those times and temperatures, because you might get translucency, but you might lose strength, or vice versa. That's just my kind of thought with them.
Why don't you just mention, some people may have no idea what the sintering time is. It can be 1.5 to 8 hours, right?
Yeah. I know that was like the original thing with the and that always gets, when we talk about translucency of zirconia, we could talk about, when Bruxer came out, that was actually supposed to be translucent zirconia, and then when the anteriors, those are more translucent. Same thing with like fast firing zirconia. I remember talking about fast firing, and to me that meant like 20 minutes. But then there's some people that talk about 1 hour firing as a fast fire, because it's 1 hour as compared to 8 hours. So yeah, I know that the times can vary a lot. I think the times probably, there's a
most labs it's 6 to 8 hours. So which limits, because I've had doctors where they say, oh, a crown broke. I called my lab and I said, can you just make me a new one? I can pick it up this afternoon and seed it. And zirconia, you just can't do that because of the sintering time being 6 to 8 hours. I mean, it's an overnight procedure.
This is a picture I took. This whole group of crowns there, I had gone in. We don't have a zirconia sinter in the research lab, but we've got one in the dental school. And so sometimes when I need to make specimens, I'll go and I'll borrow their sintering furnace, and I'll have to program in my own programs. And one day I programmed my own thing, and then I left and I forgot to change it back to their original program. And they fired this whole batch of crowns with the wrong sintering fire, and they all came out this white opaque. They look like little Dalmatians, like white and brown Dalmatians. All the lab, but they were so pissed at me. You realize how many crowns you just ruined. I thought they were never gonna let me back in, but they're super nice, and they forgave me by the next day. So but yeah, so you can really screw up the crowns by relatively small changes in the sintering time and temperature. And then kind of, you're talking about the 7-8 hour, 6 to 8 hour firing. There's also, for the CEREC type of people, there's the speed fires now where they can do the fast fire in 20 minutes. And we tested those types of zirconia. What we found out was that the speed, if you get materials that are made for speed fire, we found that they had their same properties if they were conventionally fired or if they were speed fired. They didn't lose any of the properties. But if you took a material that wasn't meant to be speed fired, so we took some materials that weren't speed fired materials, and then we put them in the speed fire, and it really screwed them up. They got all these, they got this humongous grain growth, and they had, even worse, that they had all these porosities. So they were really opaque and they were much weaker. So the thing with speed fire is, just have to use the materials that somehow, I don't know what the manufacturers did to make their materials able to be speed fired, but you just can't take any old zirconia crown and throw it in a speed fire and think you're going to get good results, because you get these wacky large grains and porosities if you throw the wrong kind of zirconia in there. Should I go ahead, keep on going on to bonding?
Yeah, I think so. We didn't really get any other questions regarding that. I think you're doing an awesome job. Appreciate it.
Cool. This is where I want to talk a little bit about bonding zirconia crowns. And again, I'm not going to go through as much of a clinical process, which I'm sure is probably what people would rather see, but I just want to talk a little bit about the evidence to see how do we know that we can bond zirconia? Because I mean, honestly, in bond the zirconia crown, you sandblast it, you apply an MDP primer, and that's it. I mean, it's not that, in my opinion, it's not too hard, but the thing where I think people are just nervous is, is there evidence that you actually can bond? So, and this was I think the study that I was referring to earlier. It was about 3,500 crowns we observed from 202 dentists, and we found out that 38% of their crowns were bonded, but most of those were lithium disilicate. And if we looked at zirconia, only 30% of the zirconia crowns were bonded. And I always wondered, why was that number so low? I guess it does make sense because a lot of, zirconia is so strong that you don't need to bond it most of the time. But I also wondered, how much of it could also be due to the fact that a lot of people don't believe you can bond to zirconia. And I've heard that so many times that they think that you cannot bond to zirconia. I have to put in this every time I give a presentation. I want to put in a plug for the Practice-Based Research Network, which was was how we did that previous study that I just showed you. My boss runs this. My department chairman runs this. It's a super cool thing. If you're a private practicing dentist in the US, you want to get more involved in research, you want to run a study out of your clinic, the Practice-Based Research Network is extremely well funded by the NIH. They're always looking for new dentists to enroll. I'm actually writing a grant that's due February 9th. We're going to look at the progression of interproximal caries. There's a really cool one out right now that's comparing selective caries removal versus complete caries removal. So it's a really neat thing. That's their website, Practice-Based Research Network. Anyhow, but this is what a lot of people are thinking. Can you bond to zirconia? Where is the evidence for it? So the first place I always think, to go would be to look at the published research. And when you think about the published research and laboratory tests, even better than a laboratory test are these systematic reviews. So that's just a review of, it's a systematic review is a review where they've actually told you how they're going to search the literature and have a clearly defined protocol for searching the literature and what studies they include. And then even better than that is the meta-analysis, where they actually pull out all the data out of these laboratory trials. And so what I wanted to show is that there was, these are some of the best journals in dentistry: Journal of Dental Research, Journal of Adhesive Dentistry, JPD, and Journal of Mechanical Behavior Biomedical Materials. So some of the biggest journals in dentistry have published these systematic reviews and meta-analysis. And, I'm not going to go through all the data points, but this was a study that was in Journal of Dental Research, highest impact factor journal in dentistry. And they looked at 144 different studies, and they compared a bunch of different factors. Broadly, they looked at laboratory data in which they tested bond strength immediately, and then some where they aged it. And kind of the conclusion of what they found is that if you did sandblasting and you apply that molecule MDP onto the surface of zirconia, you can improve its bond strength. So that showed that sandblasting and MDP allowed a bond to zirconia. This is a systematic review and meta-analysis of 52 studies. And one of the neat things in this review is they looked at, using a separate MDP primer or using a cement that contained MDP. And in both cases, they found that if you sandblasted and then either used a cement which contained MDP or use a separate MDP primer, you get an increased bond to zirconia. And this is just the last one. It looked at 24 hours, bond strength, 2 days to 6 months, and then longer term lab. And they found the same kind of deal with the sandblasting and application of MDP, improving the bond to zirconia. So this, so basically from these studies, we found two things. I'll stop this video while I talk. So we found two things. One is that if you need to sandblast zirconia, and then two, that you need to apply MDP, and that allows you to get a higher bond in bond strength studies. Some people say, well, where's the clinical data? Some of the clinical data comes from things like Matthias Kern has got these famous Maryland Bridge essentially studies where they've done Maryland bridges out of zirconia, where they've shown long-term clinical bonding of zirconia. But basically, in order to believe that you can bond to zirconia, you got to think two things. I mean, anytime you bond a ceramic, you got to roughen its surface, and you have to have a chemical bond between the ceramic and your resin cement. And so With zirconia, you cannot etch it with hydrofluoric acid, so you have to sandblast it to bond to it. So one question will be, if you sandblast zirconia, does it actually do anything to the zirconia surface? And so this is, here we've taken some zirconia specimens and we're sandblasting them in our sandblaster. And we use 50 micron alumina for 10 seconds and 2 bar pressure. And the thing, I can understand why a lot of people say, zirconia is so strong, you can't sandblast it, nothing happens, because if anybody's ever taken a zirconia crown, put it in a sandblaster and sandblasted it and looked at it, you don't get that pretty, or that, warm fuzzy feeling that you do with lithium disilicate when you etch it and it gets frosty. Like zirconia, you sandblast it and it looks pretty much the same. And you think, did I just waste my time? Did this do anything? So let me show you that, you haven't just wasted your time. Here's a bunch of different zirconia crowns. We cut them in half just to save some money. And then we looked at the control ones that were sandblasted with glass beads, with alumina particles, or with Rocketech. If you don't, Rocketech and Cojet, they're the same thing. They're silica-coated alumina particles. And what we found out is that if we looked at the polished versus the glass beads versus alumina versus the Rocketech, let's get a little higher magnification to make it easier to see. So the polished ones, the surface stayed pretty smooth. Glass beads don't really do anything to the surface of zirconia. They're not going to roughen it up at all. You could see here with the alumina particles where we've got these little divots in the zirconia that have actually created some roughness in the zirconia. And it's really easy to get that roughness with alumina particles on zirconia by sandblasting with alumina particles. Rocketech, some people think Rocketech is going to be softer than alumina particles. Rocketech, though, basically just it's alumina with a light dusting of silica on top of it. And what it does is it embeds silica into the zirconia. And then once you've got silica, which is the same thing as glass, you can now use silane to bond to that embedded silica. For me, I kind of feel like it's like an unnecessary, complicated way to bond to zirconia. It's easier to just sandblast it and then bond to it with MDP. So, but a lot of people ask about Rocketech, so I just wanted to show the picture. David, I think you're muted.
Let me unmute. Someone asked about what is MDP, and you're going to cover it. The other thing too, from those reviews of studies that you showed, you said that the studies basically showed that bond strengths increased with MDP or a cement that contains MDP. Mm-hmm. Was there a difference between those two? A pure MDP and then a resin cement versus a resin cement that was combined with MDP?
I had to, I don't know. I'll be honest. I mean, there's so much data in that review. I can't remember what that particular review said. We've tested, I don't know if you're saying, I think there's people skeptical of using an MDP within a cement. We've had really good bond strength values with Unisem 2 and Panavia SA, both materials that have phosphate-based functional group. Unisem's got a phosphate-based methacrylate in there. Panavia SA's got MDP in there, and we've tested the bond to zirconia with those without any types of primers, and always get a really high bond to those. So yeah, I mean, I don't know what, I don't know where you stand with, because I know everyone has kind of different feelings towards. Some people have said you definitely got to just use the pure primer, don't trust the MDP and the cement, and maybe different experiences with, Yeah,
I like to use a separate MDP.
Okay.
You've showed there. I like
the Z Prime
product. Yeah, Z Prime Plus. So someone asked, what does MDP stand for? What's the
10-methacryl oil oxydecyl dihydrogen phosphate.
That's why no one ever says it.
Yeah. So I'm glad that's a great segue into this section. So, I mean, like I said, a lot of people, it's easy to show people that sandblasting zirconia can actually create surface texture. I mean, you can't see it visually, but you can see it microscopically. This is the hard part. This is the hard part to convince people, is to show that there's a chemical bond between MDP and zirconia. And just to start off with, I think at first there was skepticism about bonding to zirconia because all ceramics before were bonded with silane, and silane is a molecule that's got one end of it's the green, or one of it is the blue end, that's a methacrylate end that bonds to our resin cement, and the other one was this green end. It's a silanol functional group that can bond to glass. And so this linker between our resin cement and glass, and the silanol group doesn't bond to zirconia. So that's where MDP came in, and it's a molecule with this phosphate functional group. It still has a methacrylate group on the other end to bond to resin cement, but now it's got a phosphate functional group to latch onto zirconia. And so, part of the question is, does this phosphate functional group actually chemically bond with zirconia? And in order to test this, there's some fancy chemical tests that can be done. And I always say, we do simple stuff in our lab. We break and smash and crush things. We don't do fancy chemical tests to prove that there's a bond between molecules. So, but I was interested in this. And so what I did was I kind of just did a deep dive into the research. And then to learn about it more, what I did was I called up some of the chemistry faculty at UAB, not in dentistry, just in chemistry. And I said, hey, I'm really interested in learning more about some of these chemical tests to prove, that a bond exists. Would you kind of, I've read these papers. Would you kind of walk me through some of these machines and let me take some pictures? And they said, sure. So I went there with one of our residents at the time, Chenta Huang, and he and I went and we met up with this guy. I call this guy Crazy Einstein because he looked like if Einstein had like no personal hygiene, like just wacky chemistry professor dude. And he like walked me through the school of chemistry and showed me these different machines. So this one was not that complicated, one that I was pretty familiar with, and it's called X-ray photon spectroscopy. We just call it XPS. And what this machine does, we use a lot of times if we've got a specimen and we want to know what kind of elements are on the surface of that specimen. And there's a paper that was published, and they did a really simple study. And all they did was they took some zirconia, they did XPS, and they found that, of course, there's going to be zirconium and oxygen on that surface. But then they took the zirconia and they put some MDP on there, and then they rinsed it off, and then they put it on the XPS, and they found that, once you put that, when you did XPS, you found some phosphorus in there, and that phosphorus had to have come from some MDP that had stayed bonded to the zirconia. So it's like that's the simplest test. The next test, the evaluation that was done was something called Fourier Transform Infrared Spectroscopy, or FTIR. And what this test does is they take these infrared beams and they pass them through bonds of material, and they vibrate if at certain activity levels. Essentially, it shows you which bonds in a molecule are active. And so what they did was they took some pure MDP molecule, they looked at it under FTIR, and they found where the different functional groups on this, or different side groups on this functional group of the MDP are just on these, which wavelength of infrared light made them vibrate, I think. And then they mixed the MDP with zirconia, and then they did the FTIR again, and they found that these bonds here change in activity when you combine MDP with zirconia. And so that was evidence that this OH group and this double bond O group here are active when you add MDP and zirconia together. So I guess that's neat. So this was the test where I always say Crazy Einstein got real excited because he's like, oh, this is a really cool test. And I have to admit, I thought this was kind of the neatest test that I saw when I was over there. And this is something called mass spec, or secondary ion time of flight mass spec. And again, I had always heard these words. I never knew what the hell they meant until we went with Crazy Einstein. And how mass spec works is that you take some of the zirconia and some of the MDP, and essentially you combine them together in this end of the tube, and then I think you ionize it, or somehow you blast it and kind of blow it up. And then you shoot it down this tunnel, And at the end of the tunnel, it measures the molecular weights of all the different fragments that came from when you blew up this MDP bonded to zirconia. And let's say that MDP and zirconia don't bond. What you would see at this end of the tunnel was blasted up fragments of MDP and blasted up fragments of zirconia, but you'd never have any fragments that corresponded to fragments of pieces of zirconia bonded to pieces of MDP. But they did. They found fragments of pieces of zirconia bonded to pieces of MDP. And so that was a way for them to say, okay, these things must be bonding strong enough so that when they get blasted and sent down the tube, they're still attached to each other. And then the very last, this was supposed to be the highest, form of chemical testing is something called NMR. I walked into this machine. I felt like I was like, they're going to be launching a nuclear warhead from this. I mean, literally there's all these panels and these big reactor looking things. And even Crazy Einstein got a little nervous because he couldn't really explain this test and I couldn't really understand it. But essentially what you get when you do NMR is you can tell what type of bonds are occurring between two surfaces, like are there hydrogen bonds or they're ionic bonds. And you can do this based on they pick a marker element. And I think in this study, they picked phosphorus as a marker element. And they could tell the distance between the phosphorus and the zirconia atoms, and if they could approximate that distance, they could tell what kind of bonds were occurring. So they hypothesized that there are ionic bonds or hydrogen bonds that occurred between MDP and zirconia. I remember how to give this. I gave this presentation actually originally. Probably 2 years ago or something like that in an American Association of Dental Research meeting. And the guy that went after me was a guy named Bart van Meerbeek, who was one of the authors and I think it was this paper. And I'm sitting there trying to explain his paper like an idiot. And I'd constantly look over and I'd be like, am I okay? And he'd say, he's a nice guy. So anyhow, so that's kind of the chemical proof that you can get a bond between MDP and zirconia. That's how those are the different types of chemical tests that they did. And then I guess to close this thing out, to talk a little bit about teeth again, and this is just my opinion about when do you need to bond to zirconia. I mean, you always can bond to zirconia, but when is it absolutely critical? The time I think of is if I've got where I'm bonding it the most are these short second molar crowns where I've got limited occlusal clearance. And so I'm using zirconia because it's the strongest material, and then I'm bonding it additionally for strength. And then also a lot of times just because they're short teeth, just for additional retention. For Maryland bridges, which I've done, I always say I've done 2 of those in my entire life. But with the Maryland bridge, there's always, should it be Emax? Should it be zirconia? And my thought is if you have Emax, even if you had a higher bond, your failure would probably be a break in the connector, and then you'd have a wing stuck on the lingual surface of the patient's tooth, and then you'd have a pontic in your hand. Whereas with zirconia, if it's more likely going to debond, I mean, that's probably the bigger thing you're worried about is debonding, then you at least have the whole thing in your hand, and you can just go and rebond it. And then there's other goofy things that come up. Like this was a dental student, Kelsey, who was doing an onlay as a abutment tooth with a survey onlay for removal partial denture, and where she put her rest seat over here was made the crown too thin, and the lab that she had sent it to said that they couldn't do it out of Emax anymore, and so they made it out of zirconia. And then of course, because this is onlay, she was working, I think, with a faculty that said, go up and talk to Nate about how to bond this zirconia survey onlay on, because we need to bond this. So there's always little different things like that about bonding to zirconia. Bonding to zirconia. And then lastly, this last little study is going to show another advantage of bonding to zirconia is that you get less leakage with resin cements than with RNGI cements. We found this out. This was actually a study that was done by Ron Goldstein. He had this question of whether or not if you use ultrasonic scalars on ceramic crowns, if that would disrupt the cement margin. And so we compared and we looked at that. I think we found that ultrasonic scaling didn't increase microleakage, but one of the things incidentally that we found out was that we saw a lot less microleakage in crowns that were cemented with resin cement than those that were cemented with RMGI cement. So that was another kind of neat advantage of using resin cement to bond zirconium. But incredibly, like I have almost never done in my life, I finished this presentation a little bit early. So just for fun, this is we have this Instagram account called Dental Tube that I do with some of my best friends in the dental school, and we post all this information about research and operative dentistry. And one of the things we have on there is this was a ceramic bonding protocol, a simple ceramic bonding protocol that we had, and one was if the laboratory did the surface treatment for you, and one was if you did your own surface treatment in your office, and it just kind of goes through for glass containing ceramics and polycrystalline ceramics like zirconia. So that's all on there on that website. And and I have a website. It's got some, my name.com, and it's got some additional resources about ceramics and all different types of dental materials in the resources tab. And yeah, we
never finish early, Nate.
Yeah, I know. I mean, I'm not going to complain.
All right, so I've got some questions that I think would help everybody. So, someone asked about what's the bond of zirconia to dentin, and I think it's important, and I answered the question if people read them. Is we're talking about two different bonds, right? I mean, if you didn't get your zirconia right, you're not going to have any bond. If you don't dentin bond properly, you're not going to have any bond.
Yeah.
So when you guys did your study. So when you did your bond to zirconia itself, did you bond to dentin, or did you had a dye, you had a plastic dye, right?
Yeah. So we do two different types. That's a great insight. Great point. When we do bond strength testing, there's two different types of tests that we do. We do one test that's just called shear bond strength testing, where we either get a piece of zirconia and we have a little button of cement that we bond to it, or we can get a piece of dentin and have a little button of cement. And so we'll test the bond between either the dentin or the ceramic surface. Or we can do a different type of test where we get an extracted tooth and we whittle it down for a crown preparation. And then we make a crown that goes on top. I call them t-shirt crowns because they got two little handles on them, and then we pull them off. And so those are, that's what I call them crown pull tests. I think they're called crown retention tests. And those ones are, there's the advantages and disadvantages of both. I mean, I always, we have a lot of people that have come to us to do the crown retention test because not a lot of people do that. And it's neat because there's a lot of clinically applicable things. Like you can see, if your cement thickness has an effect on the retention, or, any of the, you're testing both surfaces at the same time, and it's a more clinically applicable test. The shear bond strength test, where you just bonding zirconia or just bonding dentin, those ones I think are a lot easier to do, and they're a lot cleaner because you're just exactly which interface you're testing. But yeah, I think and you bring up a great point. Is like, I think if someone's having problems with debonds, the most insightful thing they can do is look at their crowns and look at their teeth and try to figure out where the cement is, because wherever the cement is, then that's what they're good at bonding to, and where the cement's not, that's what they're not so good at bonding to. So like sometimes people will say, well, can't bond zirconia, or, and they say, well, do you ever take your crowns out? Where's the cement? And if the cement's on the zirconia crown, well, you just bonded the zirconia really well. It's just maybe you didn't have good isolation on the tooth or something like that. So,
did you thermocycle those on your bond to zirconia?
Yeah, we always thermocycle. I don't think I showed any. The ones I showed earlier were a crush the crown test.
Right.
It's funny. I made this presentation cognizant of thinking not running over in time, so I took some pictures of the actual procedures out. But the test that we did there was we had a crown and then we smashed it. We have another test where we have a crown and then we pull it off. And so, but in all the tests that we do, we always like to thermocycle. Although we found that like long-term water storage reduces bond more than thermocycling, but still, it's always good to thermocycle because.
Did you find a decrease after thermocycling?
Well, a lot of the tests that we're doing, we don't test it without thermocycling. We only test it with thermocycling. Except for, we've done some bonds, because with crown pull tests, it's just so time consuming and expensive to make the specimens. When we do shear bonds, sometimes we'll do it with and without thermocycling. And that's where we found out that actually, like I think it was 60 or 90-day water storage reduced the bond more than doing the thermocycling. So, but yeah, we do thermocycling.
Yeah, because I think that's the question that often comes up is, we know an immediate test or a 24-hour test, especially shear bond, that we know we get a bond of zirconia. What is that going to look like 10 years down the road? We know that the Emax will bond. We know that Empress is going to maintain that bond. Yeah. What are your thoughts?
So we've got a paper. One of my favorite guys, a guy named Daniel Kwan, was the lead author on this paper, JPD, I think 2018 or something. And it's a study that is like so simple, and you would think so many people would have done it, but it's so hard to find in a lit, which is just a study that looks at shear bond strength between zirconia and then also between Emax in the same study, both immediately and long term. I think maybe 60 or 90 days. Of water storage. And what he showed was that actually, and this was kind of surprising, the bond that had equivalent bond between zirconia and Emax, and the bond to zirconia went down after I think 60 or 90 days, but so did the bond to Emax. So it was almost the same amount. So I mean, you lose, from, I think it's the hydrolytic degradation or something called, where the bond can break down over time in water. But it can happen with lithium disilicate, as well. So, yeah. Okay,
good. Couple other questions. I'm going to read them to you.
Okay.
Well, one asked, is this program being recorded because he missed the first 20 minutes? Yes, and you'll get that information at the end. Nate, you mentioned that you have seen good bond strength with Reliax Unisem, which is self-ething resonance cement, and Panavia SA to zirconia. Is there a published study? I'd be interested in seeing the comparison between the two, as well as
between Unisem and Panavia SA
and Reliax, basically.
Oh yeah, between Panavia SA and Unisem. I think if you, and this is harder to find, but if you know how to find AEDR abstracts, there. I mean, we've never published a study, but we have a published abstract on that with bonding zirconia crowns with those two cements, and then I think a couple others. And it's the name of the guy is Huang. It's the guy Chun Te who I showed, Huang. I don't know, 2019 maybe, an AEDR study. So yeah, and pretty similar bond between those two materials. And those were kind of the leaders of the pack with the self-adhesives.
Yeah. Okay. Another question, and I know how I'd answer this, but let's have you answer it. Would you pre-treat the zirconia sand? But wait, let me go back. One thing you didn't really talk about was the alkaline-based cleaners instead of sandblasting. I mean, a lot of people don't have a sandblaster, or they don't know what their micron size of the aluminum oxide, or they don't know what their pressure is, as in their little micro etcher. Do you want to talk a little bit about, there's two, right? Do you want to talk a little bit about those?
Yeah, I guess if the alkaline ones, there's Zirclean and Ivoclean, and then there's Katana Cleaner too, which is another newer zirconia cleaner. So the issue with zirconia is that when you try it in the mouth, you get the patient's gross old saliva on it, and there's these phospholipids inside of the saliva that will stick to the zirconia. They'd stick to Emax too. With Emax, we always just clean them out with phosphoric acid. You can clean out an Emax crown or veneer with phosphoric acid. With zirconia, if you try to clean out with phosphoric acid, instead of getting the phospholipids stuck to the zirconia, you're going to get phosphor-based contaminants stuck to the inside of the zirconia. And so so, to get around that problem, they've got these cleaning solutions. The first one that came out that I think everyone knows is IvoClean, and that's one that was used to clean out the surface of the zirconia. And then there's another material like that. It's called Zirclean that was comes out from Bisco, and there. Read somewhere that I think we actually found out what the name of the active ingredient is inside of them. I've kind of forgotten. They're both alkaline.
IvoClean is a sodium hydroxide.
Okay.
And Zirclean is a potassium hydroxide.
Okay. So it's funny because with the IvoClean story originally was that there were little particles of MDP or little particles of zirconia in there, and then all of the all those phospholipids, instead of wanting to stick to the zirconia, they saw all the little microscopic zirconia particles in IvoClean, and they go stick to those. And then once they were stuck to those, you'd go rinse them out with water. And that was the story I was always told. But then I don't know, I remember even trying to look under a microscope to find those little microscopic zirconia particles. I could never find them. And then you find out, that's not the story being told with some of the other cleaners. So I don't totally know how it's working chemically. I don't know if I'll ever know. But.
My conversations with Young Sa up at Bisco.
Okay.
He was saying, so you described it well. If you're trying to crown, you get these phospholipids from saliva. Mm-hmm. There's receptor sites in the zirconia for phosphate groups, and that's what the MDP is. People are asking, MDP, the phosphate groups, right? Mm-hmm. So they stick to the inside of the zirconia, and they're taking up receptor sites that your MDP would normally grab onto. So the way that Yong Sa, who's the owner of Bisco, I'm not telling you, I'm telling the 500 other people, is that the alkaline, whether it be potassium or sodium, has a higher affinity for those phosphate groups than the zirconia. So the zirconia are stuck to the phosphate groups are stuck to the zirconia. You throw either potassium hydroxide or sodium hydroxide on it, it pulls those phosphate groups from those receptor sites. Then you rinse that away, and then you've got this clean surface for MDP.
Okay.
But I just have you guys done side-by-side studies of sandblasting versus, I think probably most viewers are using IvoClean,
mm-hmm.
Have you done side-by-side studies?
So we did one study that was like published maybe 4 years ago or something like that, where we looked at cleaning with, how bad was it to clean with phosphoric acid? Bad. How bad was it if you just try to rinse it out with water? Not very good. But if you cleaned out with IvoClean, that worked great. Or you could re-sandblast it, and that worked great. And then more recently, when Katana Cleaner came out and IvoClean and Zirclean came out, we tested all those in the lab and found in our lab study, we found they all performed similarly. And then we weren't really intending to publish it. I was just curious. And then the buddy I was talking about, Taser Solomon, who's up at UNC, he actually just retested them all recently, and he was nice enough to put my name on his paper I didn't really do much of anything, but except for read it. And but he basically tested them all too and found the same thing, that all the different cleaners worked well. I think he in our study we found that cleaners could bring them back up to original strength. I think he didn't quite get up to original strength with the cleaners, but showing that they all perform similarly. And I think he kind of concluded that actually re-sandblasting was the best. When we test it, re-sandblasting works, but the cleaners work equally well. And cheap old me, I will always, at the beginning, I have a little micro etcher too from Danville, and I used to sit chair side and I try on the zirconia crowns and I'd re-sandblast them, because my thought was that sand is cheap and IvoClean is expensive. But after making enough particles going everywhere and making a big enough mess, I started thinking, well, the school buys the IvoClean. Why do I care? How much it costs. So
IvoClean's like $26, and Ivoclar says you get 90 applications. I don't have the patience to count them, but it's not a $150 product, so it's not very.
Okay, makes you feel better.
Yeah. So, one thing I didn't really see that you said, maybe I missed it. What average bond strength are you? So if you sandblast and you're using MDP and you use a resin cement, what's your average bond strength in megapascals to that zirconia?
See, I'll just be, I mean, this is my personal bias, is that like bond strength value, like we had been testing bond strength a different way than anybody else had been testing bond strength. And it was the Burgess way. And we had these little Tygon tubes and we bond to them. And then just recently I had a long call with Neil Jessup, and he was really kind to send me a lot of their testing equipment. And we got all the Ultradent shear bond strength tests. And then, of course, like the Japanese and a lot of the Europeans are only doing microtensile bond strength tests where the numbers get higher. So like, it's really, I don't know. I mean, I know people like, there's like 30 megapascals of bond strength. It's like, oh, if you can get that, that's great. I just like in our lab, I don't think we've ever gotten to a point where I felt comfortable like reporting a raw megapascal and feeling like that's going to compare to something else. It's like more just how did it compare to the other things that we tested. So, I mean, we get values, I think in the study that we reported in the 30s of megapascal bond strength, but I'm a little bit nervous of how that compares to, I just wonder how well bond strength, how well you can get bond strength from one lab to another lab and how well it's going to compare.
So let me just ask this question, because, I did a bunch of those alternate bond studies with Neil, back in the day. And so we always compared it to our enamel bond for that day.
Mm-hmm.
So what are you typically getting in relationship to your enamel bond, your zirconia bond?
I don't know if we've ever compared this. I don't think we ever, that I can remember, bonded, like took the same cement, bonded to enamel, and then bonded to Zirconia. I mean, you'd think that, I mean, if I'm thinking about values in my head of like a typical Zirconia test and a typical Denton or bond, I mean, we get pretty similar. I mean, they're always in the, I don't know, but I don't know that I can tell you something in honest, because I can't think, never done it and looked at it to remember it to tell you.
Okay, so I'm going to keep putting you on the spot because you ended early, right? If you would have ended late, you wouldn't have to answer these questions.
No, go for it.
All right, so here it is on the spot. So if I had bonded, so let's say I used a resin cement. So I've got a piece of zirconia. Mm-hmm. I sandblasted. I use MDP. I used a resin cement. I total etched. I used a bonding agent and bonded those two together. Which surface do you think the cement would be on when that bond failed? Did you get that?
Yeah. Because the thing that we're doing now, we're doing a lot of these crown pole tests, and we do failure analysis at the end of the test where we've got to look at this, where we look at the surfaces to try to see, is exactly that thing. Is the cement on the tooth, or is the cement on this ceramic material? And it just really varies. I mean, we have so many of them that are like mixed failures, where we've got some cement on the tooth and some cement on the zirconia specimen. So it's, I guess I could tell you it's a relatively similar bond between the two substrates. I mean, I could tell you, I think a lot of people probably could relate easier to clinical. I know that when we do some clinical trials, when we see D bonds, I feel like I see the D bonds on the ceramic, like the cement is on the ceramic and not on the tooth. And then meaning we got a better bond to the ceramic than to the tooth. And I talked to a lot of times when I'm going out lecturing and ask people, where do you see the cement? If they looked, I hear more frequently on the ceramic, which makes me think I think maybe what you're getting at is that a lot of people say, oh, you can't bond to zirconia, you can't bond to zirconia. And when they debond, the cement's on the zirconia, meaning maybe you just can't bond to tooth so well, not so much bonding to the zirconia. And which sometimes I think that's, and to put myself on the spot, when we just recently published this article about zirconia that came out, we got, I don't know a better word for it than hate mail from some people saying like, you guys mentioned bonding zirconia in that study. We tried to bond zirconia, and I've got so many zirconia crowns that have fell off, and I don't think you should be misleading people that you can do this, that you can bond to zirconia. And I don't know. I just kind of wonder. I always think what could be the possible ways that you can mess up bonding zirconia. I think one of them is not really the bonding zirconia, is just messing up bonding, is just isolation because I think this is one of the hardest things about bonding is getting good isolation to bond. If I had to think of another mess up, I think about cleaning it out with either not cleaning it out at all or cleaning it out with phosphoric acid. I think that's another place where people maybe are messing up. I don't know. I always kind of wonder that, like, why is there so much anecdotal information about people saying that it can't bond zirconia, but when we do it in the lab, well, I was asked to give this presentation, and it was in London. It was like 2 years ago, and the topic was supposed to be bonding to zirconia. And I went to go talk to this group of researchers, and I'm just like, what's the point of even talking about this? In the research world, it's like 100% agreement, maybe not 100%, but there's so many people in the research world that just think it's like a foregone conclusion that you can bond to zirconia. And then when you talk in a clinical setting, there's just so much skepticism towards it. So I'm just wondering why it is that, there must be people experiencing some failures. I'm just wondering where it is, like, why are they experiencing that failure?
Yeah, I would say, well, I tell people it should always be on the glass, right? I mean, it should always be on the ceramic, the cement. If you've done things right, because I think there's more variability on dentin.
Yeah.
I'll tell you a kind of interesting story with me. So when lava first came out, and that was in 2000, and we were using, I was trying to get metal frame in my practice. So we were using lava as a coping, then we overlaid it with ceramic, right? And no one had any idea how to bond to this material, right? Mm-hmm. So we were cleaning it with phosphoric acid like we always did Empress and all the other ceramics. So we'd clean with phosphoric acid and we would use silane because we didn't have any zirconia primers at the time. And my first 45 separate crowns that I documented, all 45 of them fell off.
Okay.
And of course, all the cement was on the tooth. And of course, my bond failure was against the zirconia because we didn't know what the heck we were doing, basically. Right? And I think when people call and say, hey, the cement's on the tooth, it's something that you just didn't prepare the zirconia right. And, as clinicians, we like to blame the lab, right? The lab always sandblasts their zirconia. That was one of the questions someone asked. They always sandblast it. Mm-hmm. And then when you take it to the mouth, you're going to contaminate it or you're not going to prep it right. And I think, you covered all that, which is excellent. But, the one thing that you said that I think is so important is if someone says this crown came off, the first question you should always ask yourself is, where is the cement? Because if you're getting a whole bunch of them, the cement's in the crown, you need to revisit your adhesive technique on the tooth. And it could be water supply contamination. It can be bonding. I mean, whatever it is, right? Mm-hmm. If it's inside the crown, you need to reevaluate how are you treating that crown. And you're right, it's easy. Mm-hmm. Max or lithium disilicate or Empress, you clean with phosphoric and silane, and this just sandblast or an alkaline primer and MDP. I mean, it's pretty straightforward. And I think you've done an excellent job explaining that. Yeah. So since I do have you for 5 more minutes, if that's cool, can I keep you till 7? Well, yeah. 7 my time.
9 o'clock my time.
Oh man. Is your wife coming up and hopefully throwing biscuits your way?
He's coming at least 3 times to check on me.
Okay, good. Make sure you're still alive. Yeah. What's your thought? Because I know you're doing research down there, especially with Burgess, and I've had conversations with him about this. What's your thought on the whole dentin bonding thing? Total etch versus self etch versus select etch, the universals versus previous generations.
Like just as far as like bonding direct restorations.
Well, let me put you again. I'm going to put you on the spot because you're a smart guy. You're in my chair, right? Mm-hmm. And I got the rubber dam on, and I'm ready to bond in, let's say an Emax, right? Again, it could be Lisi or whatever. My practice would probably be Lisi. I'm going to bond that in, and you look up on my bracket table, and I have phosphoric acid, I have all bond 3, I have a universal bond, and I have a self-etching primer. Let's say I have clear film.
Yeah.
Which would you want me to reach for? Again, I'm putting you on the spot, and I apologize for that, but it's the only time we get to play like this, right?
Yeah, no. If I'm doing I guess if for a lithium disilicate overlay, my personal one, just what I'm doing is I will, if I can get to those margins, I'll be honest, like if I've got real subgingival margins and I'm like battling isolation and I'm knowing that as soon as I get some phosphoric acid on the gums, I'm going to get bleeding. Like I'm not going to risk that to use the phosphoric acid, even though I know that with most of the systems now that I use, at least, I'd get a better bond if I can etch the enamel margins with phosphoric acid. But if I can get to them, I would love to etch the enamel margins with phosphoric acid. If it's a non-retentive, I don't like to use the self-adhesive resin cements for like a non-retentive overlay or onlay or something like that. I like to, in that case, apply some type of adhesive to the tooth. One of the things that I think is the controversial step is whether or not to light cure that adhesive once it goes onto the tooth, because we definitely shown in the lab that you can get higher bonds if you light cure the adhesive before you apply the resin cement. But I worry about building up the film thickness, and I show in my lecture that you can build up a film thickness between 30 and 100 microns. 100 microns is a problem, and this is a great question to talk about with you, is that how thick of a buildup of cement or adhesive thickness is going to prevent a seeding of your restoration. Because my understanding of the lab is that the lab, when I go through design software, if I'm going to be designing a crown in we've got 3Shape design software, is that I think it's 30 microns that they use for our Emacs, and then like 60 or 70 micron cement thickness for Zirconia. But I guess that's just between the margin. I mean, that's not the whole crown, but that's just at the margin area. So if I have a 30 micron buildup of adhesive, maybe that is a little too much. And so maybe I don't want to cure that adhesive. And then I'll use a resin cement. And my thought with the resin cements is, if I'm not going to cure that adhesive, then I'm really going to cure through that Lisi or Emacs or whatever crown to try to make up for the fact that I didn't cure that adhesive. So I don't know if I answered your question or not.
Do you mind if I give you my thoughts on that?
Yeah, absolutely.
All right. So in the lab, the typical default for dye spacer is about 50 microns. That's assuming it's a milled restoration, right? 50 to 55. Now you can change that. Someone asked, they said their crowns are coming back too loose. Call the lab and see what the default is. They're also going to increase the dye spacer if it's an onlay or an inlay onlay crown where there's internal features, because those will get so tight you won't be able to seat it. It's just hard to seat, right?
Okay.
So let's say an average of 50. Now, if they're pouring up a dye and they're waxing and pressing like Lisi or Emacs or Empress, you can use a dye spacer. One coated dye spacer is 40 microns. So if you're looking at 80 microns. So that gives us kind of a starting point, right? So 40 to 100 microns.
Okay.
Serac, they were, for inlays and onlays, they were saying 125 microns because, a 3-axis mill just didn't mill it as accurate, and they needed that space. So I think one thing that clinicians are not doing is air drying that primer enough. Again, I'm going to go back to Byung Su, and Byung, I think he's like, the guru in bonding, the owner of Bisco. And he was saying after your multiple coats, those systems are designed to be air dried thoroughly, like aggressively dried. They'll have self-limiting film thickness of anywhere between 9 and 13 microns. Then your cement is 20. Even 30 shouldn't be a problem, right? If you're dye spacer. The problem is I don't think people air dry enough. It scares them. Personally, I think you should absolutely light cure that. You said you guys got higher bond values. I did a study, and it's not relevant to the universal bonds, but I was out at Ultraden about 15 years ago, and we did 100 shear bond studies. You said how easy and quick those can be done, with the Ultranet jig.
Yeah.
They were 4th and 5th generation bonding agents. So it was total etch systems, right? So the 3-part system, and then the 2-part system. When we pre-cured, or let's say when I didn't pre-cure the bonding agent, so I etched, I put the bonding agent on, I light cured, or I didn't light cure.
Yeah.
When we did the shear bond study across the board, and we used 4 different agents, we lost 50% of our bond strength across the board.
Yeah.
So I think you should cure it, but I know that people are nervous about that, like you just mentioned.
Yeah.
So apply it and air dry thoroughly and then cure it. But it makes people nervous.
No, I'm glad that you said that, because, and Yeah, it's a kind of controversial topic. I mean, there's some people just look at me absolutely crazy when they say light cure the adhesive before you seat. But there's some, like if you look at Verilink and Adhes or something like that, that's in their directions. You have to light cure that one. So, but people that, I use, materials that where it's optional. And if it's optional, I think a lot of people don't want to do it, but, I don't know. I'm kind of I'm back and forth because I in my heart when I saw that thickness 30 to 50, some places even 100 microns of cured adhesive, I think like, God, I really don't want to have an issue seating my my onlays. So, and I just kind of hoped that if I can cure through the Emax or through the Lisi or whatever, through the lithium disilicate, that it'll kind of compensate for that. We can't test for that in the lab. So we don't, because our crowns are so thick, we can't cure through them. So we don't know what would happen. So,
yeah. Well, I think Byung's thought on that, he would like that hybrid layer to be completely polymerized before he had anything that could cause polymerization shrinkage.
Yeah. Okay, that makes sense.
So, like you said, these things, your stuff's not coming out and it's not failing. So, we have some flexibility, obviously. Anyway, one last question. Have you done the MDP where, it's sandblasted by the lab and you put the MDP on, then you contaminated it, then you air dry that, or are you?
Mm-hmm. We did a study. Her name was Ankus. Oh God, her name's Paterica, but her last name's Ankuseith. She did the study. She was a PROS resident, and then we published in Journal of Prosthodontics, probably like 2017 or 2016, something like that. And we did that exact same thing, and we applied Z prime onto a bunch of crowns, and then she spit on them, and then just rinsed them off the water. And she was able to didn't lose bond strength because it made the surface hydrophobic.
Oh, interesting. All right, one last one, and again, a 701, just because someone's asked it twice. They ask if bleach to clean out those phospholipids is as effective as Ivoclean.
So we tested. I mean, when we did our most recent study, we tested that, and we did find that so when I tested it, or it wasn't me, I'm taking credit for one of my Celine Arce and a couple of the students that he worked with did the study. They found that the bleach was just as effective as using the cleaning solutions. My biomaterials brother Tayseer did it at UNC, and they found that the bleach, he said that he had to do like 60 seconds of scrubbing, and then it got close to as effective as the cleaner. So he wasn't a big fan of the bleach. I don't know. I feel weird recommending bleach because I think it might work, but if it doesn't work, I don't want to.
Yeah. And like I said earlier, Ivoclean and Zirconium are so inexpensive that it's not that big a deal. Anyway, we got to move on. I apologize if I didn't get to answer everyone's questions. There was some long ones. I'm going to give you my email address. You've seen Nate's there.
Oh, yeah.
My email address is easy. It's david@hornbrook.com. If I didn't get to something, or you thought this was awesome, or you thought it sucked, you can email me and tell me that too. I do want to really thank Dental Intel. Jerem's on there. Dental Intel, if you haven't looked at their product and seen it, it's an amazing product to evaluate the metrics in your practice. And then Utah Valley Dental Lab, I know Kent was on tonight. He's the manager of Utah Valley Dental Lab. I have a great working relationship with him. Utah Valley Dental Lab is another sponsor, and they're the ones that make this free and affordable, and we get unbelievable people like Nate. And I want to thank you, Nate. That's awesome. I've only heard you lecture one time before, and that was up in Buffalo.